Assalamualaikum and good morning to our panel of judges, doctors and fellow audience. I am Nurkhalidah Sabrina along with me Syakirah. Today we will be presenting our elective research project entitled UiTM Dental Student Perspective on Delivering Post-Dental Extraction Care Instruction with the aid of a novel educational kit. Our supervisors are Dr. Tan Su Keng and Dr. Michelle Clare Mah. Dental extraction is one of the most common dental procedures, but its complication rate has been reported as high as 26%. That is why researchers have continuously emphasized the need and importance of patient education and their compliance after tooth extraction to reduce morbidity and to improve patient quality of life. Proper explanation to the patient regarding post-operative expectation, care instruction and potential complication can reduce their stress while improving satisfaction with the treatment received. Conventionally, post-operative care instruction was delivered verbally, but unfortunately it has been reported that patients can only remember 14% of the verbally given instruction, and therefore, verbal instruction alone is ineffective. Thus, a combination of different post-dental extraction care information delivery platforms, such as media and written form, could enhance its efficiency. Center of Studies for Oral Maxillofacial Surgery UiTM has introduced a novel patient educational kit known as Post-Dental Extraction Care Kit, which is PDEC kit. The kit includes a 2 minutes informative educational video, a smartphone application that will be available in both iOS and Android format, a multilingual brochure with detailed instruction that can be brought home by patient, a set of do's and don'ts flashcards, an active model to practice manual socket compression in the dental clinic for effective bleeding control. This information is also easily accessible anywhere and everywhere by the provided QR code, which also includes the details of emergency contact number. Additionally, the PDEC kit has further expanded its applicability to patients with special needs such as blind and deafblind by providing a braille brochure detailing after dental extraction instruction. Therefore, PDEC kit can be used to enhance the post-op instruction delivery to the patient by dental student and general dental practitioner. Post-dental extraction instruction given by dental student and practitioner are often not systemic nor standardized, with some important aftercare information missing during the verbal delivery. As a result, patients were unable to practice proper wound care, resulting some potentially avoidable post-operative complications, such as prolonged bleeding and delayed socket healing. Hence, a simple yet concise and precise patient education kit might be able to aid the dental student and dentist to provide effective post-dental extraction care to the patient. Therefore, the objective for this study is to assess UiTM dental student perspective on delivering post-extraction care instruction with the aid of a novel educational kit. Figure 1 shows the PDEC kit. For methodology, first, ethic approval from Research Ethics Committee UiTM was granted prior to the commencement of the study. The survey questions used in this study consist of 20 questions pertaining to the student perception and suggestion to improve PDEC kit. They were assessed with 7-point Likert scale and 7 open-ended questions, and the closed-ended questions were in a mixture of both positive and negative statements, including ease to use, usefulness, appropriateness of the content, beneficial in improving clinical practice, patient's understanding, duration of the educational video, and etc. The phase validity of the survey question was checked by 12 faculty members, and a pilot study was conducted on 50 fresh dental graduates to assess the content validity and reliability of the questionnaire. All clinical years dental students in UiTM were recruited into the study with a convenient sampling method. An 8-minute introductory video of PDEC kit was played to all participants, and next, the participants answered the online self-administered questionnaire that was validated together with demographic profile and market survey question. And lastly, all statistical analysis was performed with SPSS version 27. An independent t-test was used to compare the perception between student with and without dental extraction experience, while one-way ANOVA was used to compare the perception on PDEC kit among different clinical years dental students.
Next, let's move on the result. Table 1 shows the demographic profile of this study. 216 out of 246 clinical year students have participated in the study, which consists of 183 female and 33 male students. 211 students are Malay, while the others from other ethnicities. 69 of them were Year 3, 67 were Year 4, and 80 were Year 5 students. The ratio of participants with and without experience in dental extraction was nearly 1:1. Figure 2 shows UiTM dental students' perception on PDAC kit. Overall, the dental students have a very positive perception on PDAC kit. 13 out of 14 positive statements were agreed by more than 90% of the survey. Meanwhile, only 4 to 15% of the students have agreed with the 5 negative statements. Figure 3 shows the comparison of perception between students with and without dental extraction experience. It was interesting to find that the dental students with dental extraction experience have given higher score to the positive statement and lower score to the negative statement. The statistically significant difference was found in 10 positive and 1 negative statement. Figure 4 shows the comparison between different clinical year dental student perception on PDAC kit. Statistically, significant difference was found in 15 out of 20 statements. The post-hoc test has revealed that the significant difference was found mainly between Year 3 and Year 5 student 14 statement, followed by between Year 4 and Year 5 student 4 statement, and between Year 3 and Year 4 student 1 statement. Almost one-third of the participants think that the PDAC kit can help both patients and dentists to better understand the post-op instructions. A quarter of them believe it assists dentists to deliver better instruction. Other benefits mentioned including help the dentist not to miss any important point, aids the patient to remember in the instruction better, provides better visualization, better rapport between dentist and patient, able to provide better patient education, and simple and easy to use. Upon questioning the disadvantages of the kit, 28.7% of the dental students have stated that no disadvantages noted for the kit. The main disadvantages pointed out by 27.3% of the students is that the usage of the kit is too time-consuming. The survey also has asked the participants' suggestion for additional tools to be included in the kit. More than half of the dental students think that the included tools are enough. Others have suggested oral hygiene kit, do's and don'ts of checklist, and a specialized kit for patients with special needs. The other suggestions included the tools that were pre-existing in the kit, but might have been missed out by the participant due to limitation of nature of an online survey. The study also has incorporated some market survey questions. Overall, the participants have provided a very positive response, which majority of them will buy the PDAC kit to aid their clinical practice as a dental student, 86.6%, and dentist, 94.4%. Next, we will move on to the discussion. This study has a very good response rate of 87.8% from UiTM clinical year dental students. A vast majority of dental students agreed that the PDAC kit is useful, easy to use, and can improve patient understanding regarding post-dental extraction care instruction. As a result of impact of COVID-19 pandemic, half of the clinical year dental students have no actual clinical experience of dental extraction on patients. It was interesting to find that the students with dental extraction experience have given higher score to the positive statement, a lower score to the negative statement, signifying that those with experience acknowledge the difficulties in delivering an appropriate and effective post-extraction instruction, thus appreciate the aids of PDAC kit in their clinical practice better than those without experience. On the other hand, as every patient perceives information differently, the PDAC kit equipped with visual, audio, and tactile guide could cater the needs of everyone. However, the possibility of reducing the duration for those usage shall be looked into as suggested by the participant. The main limitation of the study was the participant unable to experience the PDAC kit in person as this is an online survey. The students were having online classes at home due to the pandemic. Besides, a multi-center study involving dental students from other universities and also broader study groups involving in general dental practitioners in future research will be invaluable. Ladies and gentlemen, in conclusion, generally the UiTM dental students have agreed that the PDAC kit is beneficial and can help them in delivering more effective post-dental extraction care instruction to the patient. And this is our references. With that, thank you.